Welcome back to TV5 News at 9. Today we are talking about flu vaccines with Michigan Health Clinic. Joining us this morning is Dr. Tessa Dake. Thank you so much, Dr. Dake, for being here this morning.
Good morning. Thanks for having me.
You are welcome. Okay, so Dr. Dake, what is different about flu season this year? What's a little bit different?
Yeah, well, I think as we all know, for the first time in a generation, we're entering a flu season amidst the backdrop of a pandemic. So it really changes things in the midst of COVID-19.
Yeah, so why is having a flu season in the middle of this pandemic, why is it so difficult?
Well, for starters, so many of the symptoms are the same. So when we look at fevers, chills, sore throat, shortness of breath, chest pain, nausea, vomiting, we really don't know when we're staying at home, do I or does my child or does my partner have flu or do we have COVID?
Now, who is at risk for this co-infection? I hear that you can actually get the flu as well as COVID-19.
Yeah, so you may have heard the buzzword twindemic. And so the concept is that we not only have the possibility of having a flu pandemic, but we're already having this COVID-19 pandemic. And so we also really get concerned about the possibility of having both infections at the same time. And so the people that we're really concerned about, of course, are those who aren't hand washing, they're not social distancing. We know you're at increased risk if you're not masking for both flu and COVID. But then, of course, we also worry because those under the age of 6 months cannot get a flu vaccine. And we also worry, of course, about our elders. So those over 65, people who have chronic conditions like heart disease, COPD, diabetes. We know they're also at increased risk for complications from both the flu and COVID.
Sure. Dr. Dake, the big question is everyone wants to know, how can we protect ourselves? Wow.
Yeah, absolutely. And so we know that there's been a lot of data coming out about making sure we're masking, and that protects other people, because we know that with both COVID and with flu, what happens is we can have an infection and not even know it yet. We also know that social distancing and staying 6 feet apart helps. And then really importantly, we know that we do have a vaccine for flu. So those 6 months and over, we really need to be vaccinating early, so as quickly as you can. And then we also want to be vaccinating as many people as we can to prevent the spread to those who can't protect themselves.
That's great. You know, I got my vaccine and I made sure that my little ones had theirs as well. Is it too late to get a flu vaccine?
Not at all.
Okay.
So we know that vaccines are not immediate. So they don't work the second you get them. So we do know if you encounter the flu within a few weeks after your vaccine, you're not going to have as robust a response or immunity to that flu virus. But we do know that every little bit helps. And so the sooner you can get it, the better, but it's not too late whatsoever.
That's great. So if someone thinks that they have COVID-19 or the flu, what should they do, doctor?
Yeah, absolutely. So you want to be contacting your primary care provider, whether that's a pediatrician, an internal medicine doctor, or family physician. We really want you to seek care. The problem is that we manage these things completely differently. And so if you have flu versus COVID-19, we may be able to offer you medications. We may be able to give you different advice. And your doctor's office may have same-day appointments available, or they may urge you to go to an urgent care or a testing site. However, if you have severe chest pain, shortness of breath, or you can't keep any fluids down and may be dehydrated, they may even recommend emergency care.
So protect yourself and protect others. That is the key today. Thank you so much for joining us with this valuable information, doctor.
Absolutely. Have a great morning.
You as well, doctor. And if you'd like any more information, please check out the hot link section. That's at WNEM.com.